First, I want to understand
Okay.
how is geospatial technology redefining industries with we least expect, like healthcare and retail. You've given little detail, but how is that we
Yeah,
can look at more in terms of that?
I will let you know. See, healthcare, for example, has two things. One is what you call health condition mapping,
Hmm.
disease mapping. Before GIS, IT, and other things, when map making used to be done, what you call medical geography, medical cartography is a subject in
Okay.
itself. When I say about disease mapping, you try to find out areas or locations which are vulnerable to certain diseases.
Hmm.
It could be for example, could be a vector-borne disease. It could be some kind of a waterborne disease, and how that vector-borne disease or water-borne disease will flow under the certain environmental conditions. Environmental conditions means rainfall, wind velocity, wind direction, and
Hmm.
so on. So there are models where one is based on say certain water quality parameter. You say that these are the areas which has excess of fluoride, so it will lead to this kind of diseases. Okay, there are areas where say swine, so how that swine bacteria vector will move in the under the influence of rainfall, wind direction, other things. So you try to map a vulnerability zone, so complete
Okay.
data modeling. So integrated disease mapping and surveillance is one area, and based on this integrated disease mapping and surveillance, you try to assess health infrastructure mapping, health infrastructure conditions, what kind of health facilities at different locations should be there,
Hmm.
how people should access that, what kind of doctors, what kind of lab facilities, what kind of things should be there at particular location. If some location has a arsenic content more in
Hmm.
water, what kind of phc and what kind of doctors, what kind of health infrastructure should be there. So these are the things which are very very critical to uh, health infrastructure. Patient tracking is
Hmm.
another area.